What affects lactulose efficacy for hepatic encephalopathy? Imagine trying to clear a foggy window. The clearer the glass, the better you see through it. Similarly, lactulose works to clear toxins from the brain caused by liver problems, but several factors can influence how well it does its job. Hepatic encephalopathy is a condition where toxins like ammonia build up in the brain because the liver can't filter them out properly. Lactulose helps by acidifying the gut, turning ammonia into a form that is less easily absorbed into the blood, and by promoting bowel movements to flush out ammonia-producing bacteria. But its success depends on many things. First, patient compliance is crucial. Lactulose can cause side effects like bloating, gas, stomach discomfort, diarrhea, and irritation around the anus. These symptoms can make patients less willing to stick with the treatment. If diarrhea becomes too severe, it can lead to dehydration and electrolyte imbalances, such as low potassium or high sodium levels, which can make managing the condition more complicated. How well someone tolerates these side effects and their willingness to follow the prescribed dose greatly influence how effective lactulose will be. Next is how the medication is dosed. The goal is to achieve about 2 to 3 soft bowel movements each day. If the dose is too low, ammonia levels might stay high, and the symptoms of hepatic encephalopathy may not improve. If the dose is too high, it can cause dehydration and disturb electrolyte balance. The way lactulose is given also matters. It can be taken by mouth, through a feeding tube, or rectally, depending on how severe the condition is and the patient's ability to swallow. The severity of hepatic encephalopathy itself plays a role. Lactulose tends to work best in patients with overt symptoms, like confusion or coma, and in preventing episodes from happening again. Its benefit in minimal or subtle cognitive changes is less clear, and some studies suggest it might not improve mild symptoms significantly. Using lactulose alongside other treatments can boost its effectiveness. Combining it with medications like rifaximin, which reduces ammonia-producing bacteria in the gut, or with agents like L-ornithine L-aspartate that help the liver process ammonia better, can lead to better outcomes. These combination therapies often work better than lactulose alone. The state of the liver is also important. If liver damage is advanced, with complications like portal hypertension or shunting blood away from the liver, lactulose may not lower ammonia levels as effectively. The gut environment and microbiota, meaning the bacteria living in the intestines, also influence how well lactulose works. Since lactulose changes the gut's acidity and bacterial composition, variations in individual microbiota and how quickly food moves through the intestines can affect ammonia production and absorption. Finally, certain triggers can worsen hepatic encephalopathy and impact how well lactulose works. Events like gastrointestinal bleeding, infections, dehydration, or constipation can make symptoms worse or make treatment less effective. For example, after a patient with cirrhosis experiences gastrointestinal bleeding, using lactulose can help prevent further episodes of encephalopathy, but managing these triggers is essential for optimal results. In summary, the effectiveness of lactulose depends on choosing the right dose, ensuring the patient can tolerate it, combining it with other therapies when needed, managing the severity of liver disease, and controlling factors that can trigger or worsen symptoms. Always remember, each person is different, and healthcare providers tailor treatments to individual needs. If you or someone you know is managing hepatic encephalopathy, it's important to work closely with medical professionals to optimize therapy and improve outcomes.